1. Which of the following is not a function of the skeleton? A. Protects soft organs. B. Produces vitamin D.
C. Supports the body.
D. Stores minerals and fat. Answer B. Produces vitamin D. Rationale. While bones play a role in mineral storage and protection, they do not produce vitamin D. Instead, vitamin D is synthesized in the skin through exposure to sunlight. 2. Identify the classifications of bones based upon shape. A. Long, short, square, flat, and regular. B. Long, cubed, square, flat, and irregular. C. Long, short, flat, irregular, and triangular. D. Long, short, flat, irregular, and round. Answer. D. Long, short, flat, irregular, and round. Rationale. Bones are classified based on their shape into long, short, flat, irregular, and round or sesamoid bones. The other options do not accurately represent the classifications. 3. Bones that have a length approximately equal to the width are classified as what bone? A. Flat. B. Irregular.
C. Long. D. Short.
Answer. D. Short. Rationale. Short bones are characterized by their length being approximately equal to their width, providing stability and support while allowing for some motion. 4. Bones that are plate-like with a broad surface are classified as which bones? A. Flat. B. Irregular. C. Long. D. Short. Answer. A. Flat. Rationale. Flat bones, such as the sternum and skull bones, have a thin, flattened shape, providing protection for internal organs and a surface for muscle attachment. 5. Which of the following is not part of a long bone? A. Diaphysis. B. Medullary cavity. C. Epiphysis. D. Perichondrium. Answer. D. Perichondrium. Rationale. The perichondrium is a layer of connective tissue that surrounds cartilage, not a component of long bones. Long bones consist of a diaphysis, shaft, medullary cavity, and epiphysis, ends. 6. The end of a long bone is the A. Endosteum.
B. Diaphysis.
C. Epiphysis. D. Periosteum. Answer. C. Epiphysis. Rationale. The epiphysis refers to the end part of a long bone, which articulates with adjacent bones at joints. 7. The shaft of a long bone is the A. Endosteum.
B. Diaphysis.
C. Epiphysis. D. Periosteum. Answer. B. Diaphysis. Rationale. The diaphysis is the long, tubular shaft of a long bone, providing structural support and housing the medullary cavity. 8. The epiphyses are covered with _____ to provide protection. A. Articular hyaline cartilage. B. Red marrow. C. Yellow marrow.
D. Endosteum.
Answer. A. Articular hyaline cartilage. Rationale. The epiphyses are covered with articular hyaline cartilage, which reduces friction at the joint surfaces and absorbs shock. 9. The diaphysis is predominantly composed of A. Spongy bone. B. Hyaline cartilage. C. Compact bone. D. Fibrous connective tissue. Answer. C. Compact bone. Rationale. The diaphysis of a long bone is mainly composed of compact bone, providing strength and structure. 10. Compact bone consists of cylinder-shaped units called A. Osteons. B. Trabeculae. C. Haversian systems. D. Both A and C are correct. Answer. D. Both A and C are correct. Rationale. Compact bone is organized into units known as osteons or Haversian systems, which are essential for its structural integrity. 11. The joining of bones at a joint is A. Articulation. B. Diaphysis. C. Epiphysis. D. Endosteum. Answer. A. Articulation. Rationale. An articulation refers to the connection point between two or more bones, commonly known as a joint. 12. The The process of the formation of blood cells is called A. Endochondral ossification, B. Hematopoiesis, C. Intramembranous ossification, D. Remodeling. Answer: B. Hematopoiesis. Rationale: hematopoiesis is the biological process through which blood cells are formed, primarily occurring in the bone marrow. 13. Concentric rings of bone matrix in compact bone are called A. Lamellae, B. lacunae, C. canaliculi,
D. Endosteum.
Answer: A. Lamellae. Rationale: lamellae are the thin, concentric layers of bone matrix that form the structural framework of compact bone. 14. Compact bone consists of cylindrical units called A. lamellae, B. canaliculi,
C. Osteons.
D. trabeculae. Answer: C. osteons. Rationale: osteons, also known as Haversian systems, are the cylindrical structures that make up the compact bone, containing blood vessels and nerves. 15. Blood vessels travel from one central canal to another central canal through A. Canaliculi, B. Medullary canal, C. Perforating canal, D.
Trabeculae.
Answer: C. Perforating canal. Rationale: perforating canals, Volkmann's canals, connect central canals and allow blood vessels and nerves to travel between them, facilitating communication and nutrient exchange. 16. Spongy bone is characterized by bony plates called A. lamellae, B. trabeculae, C. lacunae, D. canaliculi. Answer: B. trabeculae. Rationale: trabeculae are the thin, bony plates that form the lattice-like structure of spongy bone, providing strength and support while minimizing weight. 17. Yellow bone marrow consists mostly of A. cartilage, B. fat tissue, C. red blood cells, D. white blood cells. Answer: B. fat tissue. Rationale: yellow bone marrow primarily consists of adipose, fat, tissue, serving as an energy reserve and playing a role in the body's fat storage. 18. Identify the bone cell that is derived from the type of white blood cell called monocytes. A. Osteoprogenitor cells, B. osteoblasts,
C. Osteocytes, D. Osteoclasts.
Answer: D. Osteoclasts. Rationale: osteoclasts are large, multinucleated cells derived from monocytes, and they are responsible for bone resorption, breaking down bone tissue. 19. Bone-forming cells are called A. Osteoprogenitor cells, B. Osteoblasts,
C. Osteocytes, D. Osteoclasts.
Answer: B. Osteoblasts. Rationale: osteoblasts are specialized cells that synthesize bone matrix and facilitate bone formation. 20. Cells that break down bone tissue are called A. Osteoprogenitor cells, B. Osteoblasts,
C. Osteocytes, D. Osteoclasts.
Answer: D. Osteoclasts. Rationale: osteoclasts are the cells responsible for bone resorption, breaking down bone tissue and releasing minerals back into the bloodstream. 21. The process of bone formation from a fibrous connective tissue membrane is called A. Hematopoiesis, B. Endochondral ossification, C. Intramembranous ossification, D. Remodeling. Answer: C. Intramembranous ossification. Rationale: intramembranous ossification is the process through which bone develops directly from mesenchymal, fibrous connective tissue, typically seen in flat bones like the skull. 22. The process of endochondral ossification uses a model of underscore 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 to form bones. A. Fibrocartilage, B. hyaline cartilage, C. Fibrous connective tissue membrane, D. Adipose tissue. Answer: B. hyaline cartilage. Rationale: endochondral ossification involves the replacement of a hyaline cartilage model with bone, which is typical for the formation of long bones. 23. Bones grow in length at the A. epiphysis,
B. Diaphysis,
C. Epiphyseal plate. D. Periosteum. Answer: C. Epiphyseal plate. Rationale: the epiphyseal plate, growth plate, is the area where bone growth occurs in length during childhood and adolescence. 24. Place the following steps of endochondral ossification in chronological order. 1. Formation of bone collar. 2. Formation of primary center of ossification. 3. Formation of secondary center of ossification. 4. Ossification of epiphyseal plate. A. 1234. B. 1243. C. 2134. D. 2314. Answer: B. 1243. Rationale: the correct order of endochondral ossification is 1. Formation of the bone collar. 2. Formation of the primary ossification center. 4. Ossification of the epiphyseal plate. And finally 3. Formation of the secondary ossification centers.
25. List the steps in bone fracture repair in chronological order. A. Hematoma, fibrocartilage callus, bony callus, remodeling. B. Fibrocartilage callus, bony callus, hematoma, remodeling. C. Hematoma, bony callus, fibrocartilage callus, remodeling. D. Remodeling, bony callus, fibrocartilage callus, hematoma. Answer: A. Hematoma, fibrocartilage callus, bony callus, remodeling. Rationale: the typical sequence of bone fracture repair is the formation of a hematoma, followed by the development of a fibrocartilage callus, then a bony callus, and finally remodeling of the bone. 26. Which type of fracture occurs when the break is ragged due to twisting of the bone? A. Compressed. B. Comminuted. C. Impacted. D. Spiral. Answer: D. Spiral. Rationale: a spiral fracture occurs when a bone breaks due to a twisting force, resulting in a ragged break pattern. 27. The intake of vitamin D and calcium of older people should be younger individuals. A. The same as. B. Less than. C. Greater than. Answer: C. Greater than. Rationale: older individuals typically require greater amounts of vitamin D and calcium to maintain bone health and prevent osteoporosis. 28. Identify a bone of the appendicular skeleton. A. Cranium. B. Ribs. C. Sternum. D. Coxal bone. Answer: D. Coxal bone. Rationale: the coxal, hip, bone is part of the appendicular skeleton, which includes the limbs and their supporting structures. 29. Identify the 4 paranasal sinuses associated with the skull. A. Temporal, mandibular, sphenoidal and mastoid. B. Frontal, maxillary, mandibular and nasal. C. Temporal, maxillary, mastoid and ethmoidal. D. Frontal, maxillary, sphenoidal and ethmoidal. Answer: D. Frontal, maxillary, sphenoidal and ethmoidal. Rationale: the 4 main paranasal sinuses are the frontal, maxillary, sphenoidal, and ethmoidal sinuses, which are air-filled spaces in the skull. 30. The paranasal sinuses drain into the dash and the mastoid sinuses drain into the dash. A. Nose, inner ear. B. Nose, middle ear. C. Inner ear, middle ear. D. Middle ear, inner ear. Answer: B. Nose, middle ear. Rationale: the paranasal sinuses drain into the nasal cavity, while the mastoid sinuses are connected to the middle ear. 31. The membranous regions in between the cranial bones of a fetal skull are called A. Fontanelles. B. Foramina. C. Sinuses. D. Sutures. Answer: A. Fontanelles. Rationale: fontanelles are the soft spots on a baby's skull where the cranial bones have not yet fused, allowing for flexibility during birth and growth. 32. Identify an example of a cranial bone. A. Ethmoid. B. Nasal. C. Vomer. D. Zygomatic. Answer A. Ethmoid. Rationale: the ethmoid bone is a cranial bone that contributes to the structure of the nasal cavity and the orbits of the eyes. 33. The cranial bones that forms the forehead, a portion of the nose and the superior portion of the orbits is slash or the dash bones. A. Ethmoid. B. Frontal. C. Parietal. D. Sphenoid. Answer B. Frontal. Rationale: the frontal bone forms the forehead and contributes to the upper parts of the eye sockets and the nasal cavity.
Thank you for taking the quiz. How many did you get? Let me know in the comment section.